Very excited about our speakers today. We're moving more into cutting-edge therapies for your practice, and we're starting off this morning with Dr. Rita Ellithorpe MD. She's a graduate and guest faculty member of Capital University of Integrative Medicine, Washington, D.C. since January of 2001. There she taught anti-aging medicine and natural hormone replacement therapy for women and men. She's a diplomat of the Board of Anti-Aging Medicine, as well as the founder and medical director of Tustin Longevity Center. She provides a practice rooted in a functional approach which integrates the best of standard Western medicine and effective natural therapies. Dr. Ellithorpe holds a second doctorate in integrative medicine focusing on health at the cellular level. A national speaker on the topics of oxidative stress and anti-aging, she also has published her research in several peer-reviewed journals. We are proud to welcome Dr. Rita Ellithorpe. And by the way, she flew in late yesterday and is flying out today because her son's getting married on Monday, so we're really happy that she was able to be here.
One down, one to go. Thank you for inviting me to talk with you. I am really motivated to be a part of this, I guess to the extent that I would even take a break in the busy wedding preparations in my son's wedding. This is a noble cause that we're involved with as healthcare providers. This is a needed cause. These are needed conferences. And I want to thank Jeff and Cher Zavik for inviting me to share with you. I am here, I think, because I use IgG food sensitivities very extensively in my practice. There isn't a day that goes by that I don't reference them. I literally address this with each and every one of my patients. In the course of my being here, I've been asked to share with you how this is actually used in my practice. How do I bring this up to my patients? What is it that I share with them? How do I pick out of their clinical history their need for IgG food sensitivities? And that's what I'm going to do with you today, is just give you a practical, functional reason why I bring this up to my patients. I'm very grateful. I thank God I'm very successful in my practice. I want you to understand that I have no need for advertising of patients, and I'm very thankful because my patient base comes from personal referrals. Once I see a patient, then they bring their husband. Once their husband, they bring their buddies. They bring their sisters. They bring in their parents. They bring in their children. I have never had, over almost 10 years at my current practice, ever, I think I spent $128 last year on advertising. I continue to grow, and I am very grateful that I'm, well into the, I don't keep this, but into the multi-million-dollar venue. And yet, I spend time with my patients. My full schedule would maybe be, on an average, 8 patients a day, sometimes 6. So how can I make that much money in a practice with seeing patients? My new patients are at least an hour. All my follow-up patients are a half hour. Absolutely. And I usually go over a bit. That's because I believe in what I do, and I love what I do. Because I love seeing my patients get healthy. I love seeing them come back with an inspiration that their symptomology is resolving, their arthritis, their foggy brain, their fatigue, their PMS syndromes, their irritable bowel syndromes, their chronic psoriasis, their alopecia, their hair loss. I have even, I'm going to bring up the story. I had a woman who was 47 years old. She came to me. She had 2 adolescent children, 12, 13. Her husband brought her, drove her in. She was legally blind. She had the stick, that a blind person uses. She could make out dark and images versus light contrast. And what was her diagnosis? She had optic neuritis. Well, she had a flare maybe a year and a half, 2 years prior to coming to see me. First started in her right eye. Then, of course, she went to the ophthalmologist and hospitalized with steroid infusions and then oral steroids. And then she had a remission. Her vision in her right eye came back somewhat but diminished. Then it flared in her left eye. Same round, same treatment, lots of oral steroids. Then it came back again in the right eye. This is her third. Then it came back into her left eye. There was her fourth. Now she was being put on other experimental chemotherapies, actually, to suppress her immune system. And then on her fifth remission, when she was declared legally blind and couldn't drive and so forth, she comes to me. This woman is a 47-year-old Caucasian female who had, as I'm going to show you my clinical history here that I went through with her, just a terrible lifestyle as far as diet management, many factors in her history that injured her gut. I used the IgG food sensitivities. I addressed the importance of her diet about cell membrane injury. She changed her diet. I used many other functional approaches. You could put in there restoring the gut with good bacteria, essential fatty acids, enzyme therapies, and the food sensitivity avoidance. And what happened? She came back within a year driving herself with her vision. Now, doesn't that make you as a clinician say, I like going to work? So that's why I'm here. Now, I'm technologically challenged, so I'm going to move forward. Here we go. Oops, now I'm going to move backward. Can you move me backward? One. Okay, all right, I see it. Okay. Well, yeah, I got it, yeah. I have a patient come in and I sit down with them, and actually I have every single one of my patients look at a video. I will not see a patient until they watch my video. I'll even mail it in a new patient package to them. And my video lays out this philosophy that I'm sharing with you, so that they know what they're going to get. And when I sit down with them on their first visit, I explain to them, everyone's worried about the air we breathe and the water that they're drinking. And I try and emphasize to them that the food we eat, of course, without which we would die just as easily. Next, please. Oh, he's doing it. Okay. I start out by informing them that the tube, this beginning of the tube that goes down into your gut and circulates around and comes out the back end, you'll see I'm a very practical doctor during this lecture, is so important that we have to elevate this concept up. The marketing industry out there is trying to get you to go to restaurants habitually, like McDonald's, Golden Arches, trying to patternize your eating, trying to tell you breakfast is, a certain IHOP or going to Denny's restaurant fare. We're like little psychological consumers with our food, and I'm trying to destroy that image for them. And I tell them, listen, do you ponder about where you're going to have or which bathroom you're going to use for your next bowel movement? Do you ponder what color tissue, toilet paper? Do you think, what kind of music will I play during this movement? What candle am I going to light during this movement? The aroma candle. No, you don't do that, but I'm sure I could talk some marketing person into making the functional aspect that we all have to have bowel movements 2 or 3 times a day, and I think that's novel. Most people don't have them 2 or 3 times a day, but they would market to that if we could get it going. And I say, I'm trying to dethrone eating the variety and the entertainment of the experience of eating to a functional service of the body, thinking about what's important for my body and getting it handled. So when I see a patient, I tell them, where were you born? I have I'm in Southern California, and there are a lot of Persian people there. There's a lot of lead piping still out in that industry there, a lot of toxins there, and a lot of exposures, since the Kuwait Wars with inhaled toxins and stuff. And they have a pattern of eating that's different. Then I have the American Caucasian, and we have the Americanization of their diet. I try and find out where they're from, as well as their inhalants that they're exposed to. I find out if I was born in Chicago and I'm living in California, my allergy, the inflammation, the cell membrane damage of the food that we take in, the inhalants we take in, the water and the lead piping, in America has been outlawed, but it impacts us. So they're surprised I want to find out where they're born. Because, and then, in the experience where they've been in their life, they've been in one region, then they took a trip as a Peace Corps worker, then I find out that they had malaria, or I find out they had dysentery. I have a lot of young people in Southern California that go to Tijuana, and a lot of them get Montezuma's revenge. All of this is talking about the fact that the membrane of their gastrointestinal tract, this life tube, the support tube from your mouth to your anus, is a membrane that has to be taken care of, just like your skin has to be taken care of, and it's assaulted. And inflammation of that lining allows bad things to enter your body. And I remind them that food is a chemical messaging system, either for good or it's going to harm you. So I think about their diet, their background, their fillings in their mouth, their allergen exposures, their unique dietary exposures, when they were Americanized and assaulted with the repetitious pattern of restaurant eating or college food fairs, things like that. I talk about their birth. I say, were you born vaginally or by a C-section? They're surprised that I start so early in their history. Well, I find out many times my patient population, they were born maybe at an 8-month delivery. Do you know, of course, that we're having more and more premature births, more and more eclampsia, more difficulty with pregnancy deliveries, right? And many times these children are born sooner, and they're born by C-section, and without the C-section, I mean the passage vaginally, where you get in the woman's vaginal lining the lactobacillus, that is ingested orally by the baby and up the nose. That's the baby's first inoculum into their gut of good probiotics. And without it, they're at a disadvantage. Then the next thing, were they breastfed? So this inspires my patients to say, hey, she's really interested in my beginnings. Because those beginnings are a start for the gut. And if they were prematurely born, or I ask, did you go home right away with your mom? No, I was there 2 weeks. Or you know that these kids have probably been put in neonatal care for days or many days or a day or two and on antibiotics prophylactically. And that's an assault to this tube and the wonderful probiotics that are a part of the intimate lining of the intestinal villi. I also talk about their birth weight, because babies that are born very heavy are very possibly influenced by the inflammatory impact of their mother's high insulin and high sugar levels, okay? So big babies suggest an inflammatory process. Remember, a baby being born is a wet creature that moves into a drying environment, and that tube is all wet, and the gaps are larger between the cells. In fact, when I'm inspiring them to use food sensitivities, I put my 2 fists together and I say, this is your gastrointestinal tube, and when you're born as a baby, it's inflamed. There's gaps there, and items can slip through there. So that many of these kids who were born and not breastfed had early assaults of food and food additives, God knows what. We're dealing with the melamine, problems in China with their food. So you have to think how inflamed and wet and how the gaps are open on the babies. Then I find out, were they underweight? If they said, yeah, I was a tiny baby, then they're usually premature and at risk for having the neonatal intensive care time, and I get a lot of that out of them. Another thing is, I go over their blood type. I discuss the immunological impact of I call their immune system the airport security system. They do a surveillance through your immune system and the gut-associated lymph tissues, pyropatches, of the chemical messaging system that food has. What makes you allergic to peanuts? What makes you mildly sensitive to it in an IgG fashion? I don't know if we have all those answers, but I do know that about 89 to 92% of every patient that is self-referred to me, and I don't advertise, they're A-type blood. How many of you screen 100% of all the blood types of your patients? I do. Now, why do sick people come to me with A-type blood? There is something about the digestive and related patterns of blood type to the ability of them to digest their food. And I find A's, as the history has shown, have a decrease in the betaine hydrochloric acid and a diminishment there. So if you're not breaking your food down from birth due to a type A blood, which I believe completely, then you're having inappropriately broken up fats, proteins, and sugars, mostly the fats and proteins, and these are then monster molecules, foreign molecules that are released out of the stomach into the intestine, and their poor immune system is saying, what is this weirdly digested protein? What is this weirdly digested fat? And their little tummies become inflamed with this response as the white blood cells begin to explode and reopen up those gastrointestinal lining junctions. The tight junctions are no longer tight. So then you have to also remember, this is so important, that we were even made and created to have a separation of the enterohepatic circulation, that the blood that services the gastrointestinal system is filtered through the liver before it's allowed to go into our central circulation. So something's very important about the screening mechanism of the airport security people called our immune system in the gut. So my patients like those examples. Now, I go over in their infancy and I sectionalize my history, birth, where were you born, location, your infancy and toddlerhood, and the manner of their birth, their birth weights, and things like that. But I ask them, were you a colicky baby? And they go, oh yeah, my mom told me. I was a terror, I cried all the time. Well, colicky babies are often babies who are trying to tell you that my little gastrointestinal system is already becoming inflamed, and that's going to set off a whole history of issues. They bring up, and when they're asked about their infancy, things that you would never realize. Cradle cap. How many of us asked, did you have cradle cap? These are all outward expressions of autoimmune phenomena showing up in infancy. One woman, I saw her, she's 64 now, but at 54 she had sudden paralysis, just came all over her from her chest on down. And she was diagnosed eventually with transverse myelitis at the T4 area. So something demyelinated her spinal cord at the T4 area. And she's been paralyzed since. And of course she's gone through all kinds of testing and all kinds of anti-inflammatory immune suppressive treatment therapies, and she's on a motorized wheelchair. And she comes to see me, maybe 6 months now. And during this interview, I said, well, was there anything going on? Were you a colicky baby? Did you have cradle cap? Did you have skin rashes as a baby? Were you hospitalized, given antibiotics? And she goes, well, you know what? I had a hemangioma on my left scapula, and they radiated it, and she showed me where it was, and guess where it was? It was right at her T4 section of her spine. So you see, in the course of this history, why do we get as adults or even younger now, we're seeing kids come in at younger ages with old adult diseases. Why do you suddenly get rheumatoid arthritis? Why do you get MS, multiple sclerosis? Why do you get the autoimmune phenomena showing up later in life? It starts somewhere, and I'm telling you, it starts in their history. And in this woman, why did she have the attack at her T4? Well, she is a type A blood, and she always had the history of the colic, and then she had, as we'll go on, some other histories that go along here. But my point being is it took years and decades of an immune cytokine inflammatory response going on that hit her weak spot, just like a football injury in an adult man. You know, he says, when I was 14, I blew out my knee. Guess what he has at 54? He has a lousy knee that we're going to put a knee replacement in, right? Well, this woman had radiation of a hemangioma at T4, and voila, that's why she's got it. And we're working on remyelinating her. I'm not giving her false hope, but she's certainly getting better already. I go over their stature. Were you a thin kid, fat kid, average kid? Because if they're a fat kid, they're already being set up for metabolic syndrome, cell membrane stresses. I talk about, did your mom put tummy packs on you, give you enemas, castor oil? And all these stories come out about their intimate bowel history, that they've had problems especially. I go over their childhood asking them, were you sneezing, tearing, achoo, you know, this kind of wiping, going to the doctor, blowing your nose, and they're given drug therapies, not to mention all the ADHD therapies and Ritalin and stuff. But all these things are assaulting the cell membranes, and it's making them exposed, leaky, having the opportunity for the stuff in our food to enter into their body abnormally, where it's supposed to stay in the gastrointestinal tract and be sent out. I go over such things as, you know, were you visiting doctors? Did you have chronic congestion? You know, antibiotics, antihistamines. Did you have eczema as a kid? Patches? Oh yeah, I had all these patchy skin problems. Yeah. Oh yeah, and I was put on steroids and topical steroids. And then I started having migraines at 12, and I still had the tummy issues. And these weren't big things, you know, but when you add them all up from their childhood, they are big things. Oh, I had a tonsillectomy, and I had antibiotics for that. Oh, I had ear tubes, and I had antibiotics for that. So you see, these are the stories of just people being assaulted environmentally, dietarily, and through the medical system with many things that create cell inflammation. I even get the association, these kids who are bedwetters, and even into their teen years. This is just the irritability of the inflammation having its continual impact. So when I put them on these functional lifestyle changes to calm down their cytokine, you know, immune cell response to food allergens and other things, then their bedwetting goes away, or their bladder irritability improves. What is, you know, interstitial cystitis? It's just a catch-all term for we don't know, and it's an inflammation, so when you stop these inflammatory assaults, they get better. I even go into their birth order. Very often the eldest has more immunoneurological, psychological impact and cortisol stress, adrenal stress. If they're a last child, they're very often the forgotten child, and they're the ones that goes nibbling. I ask about, you know, their parental background, divorces, impacts into their life. I'm not a psychiatrist, but I get these things put in there, and then you find the tears show up. I was sexually assaulted. Oh, that's important. Or even the young men now are coming out, or the adult men are coming out saying I was assaulted. So all these things have an impact. I go over the fact that did both your parents work? And very often, what kind of a diet are you going to be eating when both parents work? You know, you just get these massive histories of how they wind up at 25, 37, 53 with these terrible stressors. I go over their trauma. I go over when puberty hits them. I go over the acne in high school. How many were on tetracycline for a year, 2, 3 years during their high school time? Even PMS. What is PMS? It's just inflammation. When you have some dead tissue lining your uterus getting ready to be sloughed, What do you think the backflush of that dead tissue in your uterus is? It's inflammatory material, and it inflames your body. It gives you headaches. It bloats you up. The solution to pollution is dilution. So I just explained to women about this, and it creates another inflammatory moment for these women. I go over their peak weight through each of their years. I go over, what was your weight in your 20s, your 30s, your 40s. The same with men. I look for even minor injuries. I find out what kind of a lifestyle they led. Were you the athletic jock? Were you the loner bookworm? Or were you a truant person? I go into the drugs, all those kind of things. And acne, I had mentioned already. I go into their adult stressors. I ask men, at what age were you when your children were born? And they're like, oh my God, somebody cares about me. I was 30 when my first son was born. I was 32, I was 39, and I was 49 when the last one came. Well, this is a stress on a man. Just as much as it is a stress on a woman, stress has inflammatory impacts on the body. Marriage, remarriage, all these things impact their digestion. Do you digest well when you're stressed? No, you certainly don't. So you need to have an understanding about that. I go over their college, their trade exposures, what kind of work they did, and all these things. We're living in a toxic world. We are living in a world where we're ingesting so many things that injure our cell membranes. You have to give some cursory. So my intake sheet has all these little spots on it so I can run down it, but it takes me a good half hour to take my history. I go over their travel to make sure Montezuma's Revenge and what other things might have been picked up. And then I just go by each decade, anything important here. And by this point, they really get it that I'm interested in these minor issues. I often ask, why is it that women around their second pregnancy have their autoimmune phenomena? Well, that's pretty immunologically shocking to a woman's body to have a baby with 50% of the genes different. And it's usually at the second birth I start seeing their eczema start, their psoriasis start, their rheumatoid arthritis start, their thyroiditis start very often. And in men, it's usually in their late 40s and early 50s. It takes time, slowly, and I make that stressful statement to my patients. The gut is a surface area that we have to elevate to its level of importance. Just like our heart, we always worry about our heart, we worry about our breathing. But if we don't worry about our diet and the things that will inflame that gut, and I keep on wanting to help you understand, expand your fingers in this manner, so they can get the idea that when those firecrackers of those white blood cells go off, the patient gets a visual image that you're attacking your food. And they all know there's additives in there that are bad. So that I advise every initial patient that I have to get a food sensitivity testing. I have been doing this for 20 years or so. There are many places that are now offering food sensitivities. But I stay with the immunolabs, and my reason for it is the consistency of the lab material that I get back. I can send a split sample on a patient and have basically near identical studies done on them. And this is very important to me because patients are in love with their food, and they're right to eat what they want to eat. And I'm trying to inform them about the danger of these foods, what they can chemically message to them, as well as all the other things finding out. And then I have to help them walk through a dietary program that rotates their food and the exposures and calm their gut down with certain dietary programs. But they get that I care. They get that I have set my office up to have my nutritionists and supportive material here. And then they start feeling better within weeks. I can't tell you how much I love seeing the follow-up test. Let's say they'll come back 6 months later and will repeat their food sensitivities. And what do I find? Again, number one, consistency. But if they started out with, say, 10 food sensitivities, IgG, and then on the 6-month follow-up they have 17 or 23, they go, am I worse? And I say, no. Are you feeling worse? No, I feel stronger. Yes, I'm alert. Yeah, my skin rash is better. Yeah, my gas and bloating is better. My bowel movements are soft and form and twice a day and so forth. Then I advise them and I inform them that your immune system was so hit at the first time I did it, it only could get up about 10 or 11 responses to your food sensitivities. But now with a better immune system, now your body is showing the sensitivities to 17 or 18. You are better. And then I tell them when you come back, maybe in a year we'll do it again, then we start seeing them drop down to 7 or 8. And that helps them understand the process here. And that's what I see. So I review these things with my patients. I do this detailed functional history from their birth and their location on the planet Earth. And they get really motivated that, boy, somebody really is digging in here. So I feel like a private investigator very much. Well, I wanted to bring this up to you and share with you that this works. The patients will be blessed by it. And I can only encourage you that I'm available, and the next speaker, Dr. Lavelle, is going to give you a wonderful lecture, and I'm your warm-up for that, so now you can get into some real nitty-gritty. I want to thank you very much.